Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. 0.24 hours stomach bug. A 24-hour stomach bug is a viral infection that causes diarrhea and vomiting. Most cases resolve in 1 to 3 days. Sometimes called the stomach flu, the 24-hour stomach bug is a type of gastroenteritis caused by a contagious infection like norovirus. /r/n/r/n McQueen Getty Imagesrnrn A 24-hour stomach bug is really viral gastroenteritis-inflammation in your stomach and gastrointestinal tract, digestive system that causes diarrhea. /r/n/r/n Viral gastroenteritis also leads to other stomach flu symptoms that include /r/n/r/n A stomach bug generally comes on suddenly and hits hard. The symptoms then gradually decrease as you get better. /r/n/r/n symptoms usually last 24 to 48 hours. If the illness has a different cause, symptoms may or may not last longer. /r/n/r/n The stomach bug is usually caused by a virus. Food poisoning, bacterial infections, and parasites can cause similar symptoms and may be mistaken for a 24-hour stomach bug. /r/n/r/n Stomach bugs are often caused by viruses. The typical culprits include /r/n/r/n About 60% of all stomach flu cases in the United States are due to norovirus. That comes out to around 21 million norovirus infections each year. /r/n/r/n Viruses that cause stomach bugs are extremely contagious and easily passed from person to person. The fecal-oral route, from not washing hands after defecating, changing diapers, etc., is the primary mode of transmission. The following also plays a role. /r/n/r/n Symptoms may last for just a day or two, or they may continue for more than a week. /r/n/r/n Symptoms usually appear 1 to 3 days after exposure to viral gastroenteritis. Depending on the type of virus, the stomach bug can be contagious before symptoms appear and for up to 2 weeks after you recover. /r/n/r/n Food poisoning is often mistaken for a 24-hour stomach bug but is usually caused by bacteria or parasites instead of a virus. You may be able to tell you have food poisoning if others also get sick after eating the same thing you did. /r/n/r/n Symptoms of food poisoning tend to come on faster than the stomach bug. Diarrhea and vomiting often begin within a few hours of ingesting contaminated food or water. /r/n/r/n Bacteria-associated gastroenteritis is primarily related to something you ate and can be caused by /r/n/r/n These bacterial infections are transmitted through contaminated poultry or other tainted foods, including meat, produce, and dairy products. Campylobacter strains account for around 1/3 of all bacterial cases. /r/n/r/n Symptoms of bacterial gastroenteritis can last anywhere from 1 to 10 days and may require antibiotics. /r/n/r/n Parasites can also cause similar symptoms. Parasitic infections are spread through contaminated food, water, or soil. The primary culprits of parasite-associated gastroenteritis are /r/n/r/n Parasitic infections typically take longer to resolve than viral or bacterial gastroenteritis. Symptoms commonly last between 2 and 6 weeks. /r/n/r/n Sometimes COVID-19 can cause gastroenteritis-like symptoms. In some people, these symptoms may be present even if respiratory symptoms aren't. /r/n/r/n Research suggests that around 20% of those who have COVID-19 also develop nausea, vomiting, and/or diarrhea. These symptoms usually come on in the first few days, and many people will then go on to develop respiratory symptoms that are more typical of a COVID-19 infection. /r/n/r/n When describing a stomach bug, The term flu is a misnomer. In medical terms, the flu, influenza, is a common viral respiratory infection. It involves symptoms such as /r/n/r/n when you get a flu vaccine. This is what you're being protected from, not gastroenteritis. /r/n/r/NACA gastroenteritis, infectious diarrhea /r/n/r/N gastrointestinal infection that can be caused by a virus, bacterium, or parasite /r/n/r/N spreads through person-to-person contact, contaminated food or water, or contact with infected feces /r/n/r/N symptoms include vomiting, diarrhea, fever, and stomach pain /r/n/r/N vomiting usually lasts 24 hours. Diarrhea may continue for several days /r/n/r/N most can't be prevented with a vaccine /r/n/r/NACA seasonal influenza /r/n/r/N upper respiratory infection caused by a virus /r/n/r/N spreads through droplets in the air caused by coughing or sneezing /r/n/r/N symptoms include fever, chills, muscle aches, cough, and congestion /r/n/r/N may last from 2 to 10 days /r/n/r/N may be prevented with a yearly vaccine /r/n/r/N. The best way to beat a 24-hour stomach bug is by resting and drinking plenty of fluids. The main focus of treatment is to prevent dehydration due to fever, vomiting, and diarrhea. /r/n/r/N very well. Emily Robertsrnrn These stomach flu remedies may help to relieve symptoms and prevent complications. /r/n/r/N Antibiotics are ineffective against viruses that commonly cause the 24-hour stomach bug but may be prescribed to help clear up gastroenteritis caused by bacterial food poisoning. /r/n/r/N You're better off preventing gastroenteritis than treating it. Frequent hand washing, especially after using the toilet, and good food hygiene help to prevent the transmission of a 24-hour stomach bug. /r/n/r/N If you are pregnant, immunocompromised, over age 65, or recently hospitalized or on antibiotics, you should contact your healthcare provider for advice. /r/n/r/N Call your healthcare provider or go to the emergency room if you have the following. /r/n/r/N Additional symptoms in infants and children that warrant a call to your child's pediatrician include /r/n/r/N Your healthcare provider may order /r/n/r/N Those tests should reveal whether the cause is viral, bacterial, or parasitic, which can guide treatment recommendations. /r/n/r/N A 24-hour stomach bug is a viral infection. It is spread through contact with an infected person, airborne particles, and contaminated surfaces. It can also be transmitted through contaminated water or food, although food poisoning is usually caused by a bacterial or parasitic infection. /r/n/r/N Common symptoms of the stomach bug include diarrhea, abdominal pain, nausea, vomiting, and fever. Sometimes, the stomach bug may go away after 24 hours. But it may take up to 10 days before you fully recover. /r/n/r/N Treatments may involve medications to stop vomiting and diarrhea, following a bland diet, and ensuring proper hydration. Get medical help for severe symptoms. /r/n/r/N rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.